New laws and changes coming into effect. One of those laws is Oregon's House Bill 2574.
And that bill is taking steps to stop the spread of HIV in the state. Newswatch 12's Rocky Walker joins us live in studio to talk about how this bill has many calling a monumental fight against HIV. Rocky.
Tim, Haley, as of January 1st, all hospitals in the state of Oregon are required to carry PEP, also known as post-exposure prophylaxis. It is an emergency intervention medication that you can take within 72 hours of an exposure to HIV. It reduces your likeliness of contracting the virus by more than 80% if taken properly. Under the bill, all hospitals in the state, as well as the Oregon Health Authority, will need to have procedures and a supply to give a 5-day supply of PEP if someone comes in following an exposure to the virus. This comes after some hospitals here in Oregon, especially ones in rural areas, reported struggles to provide the medication to those who need them.
PEP in rural areas has been extremely hard to come by for a long time. And so every hospital having this medication will really increase the likelihood that folks who have an exposure event are able to get medication within that 72-hour window, which can be quite stressful.
Another part of this bill bans insurance plans from charging patients for taking PEP in a moment of crisis. It also provides the medication to the hospitals at no cost to the medical facility. Getting rid of the cost takes away another barrier to access of the medication.
It's really important for everyone to have access to post-exposure prophylaxis, or PEP, because any of us at any time can experience an event that causes us to be at risk for transmitting HIV.
Lexi Sylvester works at HIV Alliance, where they help to connect those living with HIV to find care, and they help to stop the spread of the virus. She said she's seen instances of people panicking to find a medical provider with access to PEP, and people panicking deciding between the medication and fronting the costs. She says this bill is a revolutionary step to access this medication. But this bill is not the end of access to PEP for those who need it. Within the bill, the hospitals are required to provide a 5-day supply to the drug. But PEP is needing to be taken for 28 days to be most effective. This mainly gives people time to find a provider to give them the rest of their treatments. But like Sylvester says, this is a step towards a future where systemic change can stop HIV. Reporting live in studio, Rocky Walker, Newswatch 12.